Hi, everyone. I'm Cassy Adams, and I'm the Care Services Director for the ALS Association in Oregon and Southwest Washington chapter. And I'm excited that everybody's tuning in today. This is our fourth educational series that we have live now on Facebook and also on our website. And the purpose of these meetings is really just to help bring information to all of you and resources and the latest on kind of what's going on in terms of ALS care and in particular around COVID-19. And I'm really excited that we have a guest on today, Lauren Brown, who many of you might recognize as one of the nurse coordinators over at the Providence ALS Center. And before I introduce Lauren, just a couple of housekeeping things. If you are viewing today on Facebook Live, we are going to invite all of you guys to chat in any questions that you have for Lauren into the chat box, and we will do our best to get those answered for you live today. If we don't get to those questions today, we will go ahead and answer those after the live event. If you are viewing this live on our website, you can email any questions that you have in to info@alsoregon.org. And again, we'll do our best to answer all of those questions for you. And if you are viewing this and want to share it with a friend or view it again later, we are recording today's session, and so we will post that and have it available for all of you at another time. So I'm really excited to introduce Lauren. Lauren Brown, who is an RN. She is one of our fantastic ALS nurse coordinators at the Providence ALS Center, where she has been since June of 2017. And she works really closely with the multidisciplinary clinic team to ensure that needs of ALS patients are addressed and cared for in terms of coordinating across all of the services. Lauren received her Bachelor's of Science in Biochemistry from University of Oklahoma, and then she went on to continue her education, receiving her Bachelor's of Science degree in nursing from the University of Oklahoma Health Sciences Center. Lauren, in her spare time, I'm sure very little that she has of that, she is also currently working towards her Doctor of Nursing practice at Duke University. So really, really happy to have you here today, Lauren.
Yeah, thanks for having me.
Yeah. So a couple of just questions to start us off, Lauren, and for our viewers, could you just share a little bit about what kind of questions you might be able to answer today? And when we had talked about this, we had talked really about focusing on managing ALS care and what that can kind of look like, particularly in the environment that we're living in right now.
Yeah, so my focus is heavily care management in the clinic. So ALS clinics, but then also managing it across the different specialties. So home health, through home, all the different specialties that go into ALS. So that would be where I would be helpful. So I know a lot of things about a little about a lot, but that would be where I'd be the most helpful, is how to coordinate. Especially, we've learned a lot. Thankfully, this is not March, because I did not know a whole lot about how we were going about things then. Now that it is May, we're doing a lot better as far as getting our needs met, thankfully.
Great. Yeah, I imagine it's probably been like an ever-changing, chasing the ball down the road too, in terms of how the clinic's structured and working and all of that.
Almost daily, it's changing.
Okay.
Yes.
Yeah. Well, kind of one question just to start us off. What would you recommend as some of the most sort of proactive things that people with ALS can be doing right now to manage their care?
So as far as staying proactive, I would just keep in contact with your care team. It's really easy when we're staying hunkered in to kind of lose that connection with your care team. We're used to having those every 3-month clinics, and every 6 weeks, you see your neurologist. And if we're not having those visits, if you're not having even the virtual check-ins or telephone check-ins, it's easy to kind of lose touch. But even just a quick telephone call in with something, a new symptom that you've noticed, or if you feel like maybe you would benefit from a quick telephone check-in or a virtual visit. That can go a really long way of keeping you up to date. We always want to stay ahead in ALS. We don't want to have to play catch up because it's a lot harder to get things quickly that we need as far as equipment goes, or even medications. You don't want to try to catch up later. You want to stay ahead of it all.
Yeah, I think along those lines too, I wonder if you've noticed that there's any access points that have been difficult for patients. Are folks still getting their medical equipment in a timely way? Are you seeing any delays in terms of just pieces of equipment that people might need to be able to get and access through their insurance?
Yeah, so one of the issues that we were having, and I think that it's been mostly worked out now, but we were having a lot of issues with respiratory equipment for a while. They were kind of holding it back, hoping to keep it for the hospitals, and being a little bit stingy in a way, just because it was getting on back order and they didn't want to lose it for anyone. So they were asking people to wash their equipment and everything. That's gotten better. I think that we didn't have, especially in Oregon, that giant surge that we were really anticipating. Everybody did a great job with social distancing, and so that helped a lot. But there has still been some other equipment as far as hospital beds have taken a little bit longer. There were some delays in power wheelchair shippings. It was really just the shipping that we were hearing from companies like this. Like we had a speech generating device that was in the shipping process, but it was delayed in that shipping part, nowhere in the business part. It was just that shipping part.
Okay.
Once again, that was more in the April timeframe where we were really in the heat of COVID, and now we've kind of settled back down where things are opening back up. So that is improving, but we still want to stay ahead just in case something were to happen again. You never know if that's going to have another flare up to where things start shutting back down. I don't think it will happen, but if there were ever to be another issue with shipping, that's where the issue would lie, is where they start thinking like, oh, mail and shipping is a hot area for things to be a problem.
Okay.
You know, I think everybody kind of saw where Amazon started not doing Prime. And so that was another issue, is where people were trying to get things from Amazon and it was taking not 2-day shipping, it was taking 2 weeks. So.
Wow. Yeah. Now we all know that, Lauren, you don't have a crystal ball and none of us do. So it's hard to predict where things are going to go and how things are going to pan out. And I know you can only speak for the Providence Center, but I'm curious if you could talk a little bit about how you guys are envisioning moving the clinics forward and just appointments in general for folks.
So as far as moving forward, right now we're doing kind of virtual appointments with the neurologist. Dr. Libby, our pulmonologist, is also doing virtual visits through the Oregon Clinic. So we have those two that can really help. And then our palliative care team also has virtual clinics. We have those 3 big areas that are covered. Medicare just approved for therapies to be covered. That you would think would be super easy. Oh, Medicare approved it, so it's done. It's not. Unfortunately, as soon as Medicare approves it, there's a whole lot of other things that have to happen in a big system. I wish it didn't have to be that way, but it does. And so we're working on that. Our goal would be to move towards virtual clinics, but we all know that virtual is great for access, especially for people that are high risk. We want to keep them home where they're safe, but you can't do everything virtually. Some things you just need to be able to have that therapist face to face with you for whatever reason. A swallow test is really difficult virtually, so having a therapist with you would be good. Being able to have a therapist walk with you with a walker, those kinds of things. So we still do have limited face-to-face clinics, and we still do bring patients in for face-to-face neurology. And so our plan would be to continue kind of that virtual clinics, hopefully, and still do face-to-face as needed, and then kind of hopefully phase back into face-to-face with keeping virtual if Medicare will continue to pay for it. That would be the dream.
Mm-hmm. Yeah, giving that access point to folks who maybe live further away or also just don't feel comfortable getting back out into the community with COVID. Yeah. Lauren, I'm wondering if you can speak a little bit to folks who aren't able to come in to any kind of appointments right now, but are doing those telehealth appointments with their neurologist, or even calling you. I imagine you guys are doing a lot in terms of telehealth and a lot in terms of phone calls and trying to kind of manage people's care. My understanding is that you guys, when you get a call from a patient, you are a great person to help sort of answer some initial questions and then kind of triage those needs onto the other providers. Is that still accurate, would you say?
Yes, I would say that that's true for all assistants. Go to the nurse first, because it's always good to just have that single access point. If you go and you're the patient or you're the caregiver and you're trying to find a million different access points, it can be really frustrating for you. So that's why we have a nurse, so that you have a single person to go to. And then that helps everybody kind of streamline the whole process. And then I can answer a lot of questions because I've been here for 3 years and I've had a lot of problems come through me. And so we've navigated a lot. But if I can't, I know a whole lot of people that know everything and I can get you to the right person.
Great. Yeah, I can't tell you how many times myself or my colleague Susan say, it's a good Lauren question. Let's go ahead and filter that over to Lauren. And we have the nurses all, including you, Lauren, on speed dial. So like to reach out a lot. So it looks like we've got some people who are familiar watching right now. Excited that people are tuned in. So feel free, folks, if you have any questions specifically for Lauren, to send those in. This kind of a tricky question, Lauren, but I've been hearing a lot of people ask about it in terms of letting caregivers or home health into the home. I'm wondering what your thoughts are, how you would advise patients as they're kind of considering that maybe they have a primary caregiver that's a family member and lives with them, kind of just some advice or thoughts around the decision-making process of having outside caregivers come into the home, and also home health, which is such a really useful service for so many people living with ALS. I'm just curious what your thoughts are and how to advise people or how to support them in making that decision.
Yeah, so I think it's a really personal decision, but my advice is usually that if you're thinking about that decision, you should probably lean towards bringing in that additional help. If you're thinking about it, it probably means that you need that help. And as long as I wouldn't go and bring in a different caregiver every single day. That is bringing a lot of extra risk that's probably not super helpful. But bringing in controlled risk is helpful for the caregiver. You don't want to burn out. Caregiver burnout is a problem. And even though you're doing your best and you have all the best intentions during this time to try to protect your loved one, it's not protecting them if you're going to end up burning out and have to bring in more people in the end anyway to make up for that. So bringing in a caregiver or two to just kind of cycle through and help is actually a good thing. And as long as they're washing their hands, they're wearing a face mask, that's okay, I think. I think that the risk can be contained, keep them the same caregiver coming back every time, I think that's good. And home health, as far as therapists and nurses, they are safe. They're doing those things. I know I talk to them all the time. They're washing their hands because they're concerned for their family when they go home too, as I'm sure many of the caregivers are. So they're washing their hands, they're wearing face masks. And once again, if you're thinking about needing home health, I definitely recommend bringing them in. And home health, that's a way of getting some of those things that our team could get you if you were coming into ALS clinic, but we can get you that PT and that OT without you having to come into clinic. You can get it right there in your home. So I definitely recommend bringing them in a controlled way.
I think that's, thank you. That's super helpful advice. And I think just a lot of families are struggling with that decision process right now. And, you know, as this is what, month 2, for maybe some people, month 3, you know, depending on how long you've been really kind of quarantining yourself. And I think that, you know, this is living with this is hard. And, you know, accessing that help and bringing it in, just being smart and thoughtful about it, is kind of a good approach, it sounds like. So we've had a couple of shout outs that you'll enjoy, Lauren. Sue Landreth says, hi, Cassy and Lauren. So thank you, Sue, for watching. And thanks, it looks like Brian and Robin and some of our other staff members are watching. So glad people are tuning in. Just a question about masks, because we're hearing a lot about it. You know, we're getting advised in a lot of areas, you know, wear a cloth face mask if you have one available outside or in the grocery store. What, you know, from a nurse perspective, when should people be wearing masks? Should people be wearing masks? What are your thoughts about wearing masks just at all right now?
So I think that people should wear masks in public. I will say that from my personal, this is all personal, not nursing, but I think that these kind of disposable paper ones are easier to breathe in. So if you find that the cloth ones are difficult to breathe in, if you have some respiratory weakness, try to find some of the disposable ones. You can they don't have to be disposable. You can rewear them. I've been wearing this one for 3 days because I haven't seen any patients with it. So those ones are easier to breathe in because the cloth ones sometimes can be a little bit, they don't let as much air through. Of course, the cloth ones are absolutely fabulous if you don't have respiratory weakness, or if you feel like they don't cause any issues, they're great too, because they're washable and reusable. But you don't need to wear them in your home, obviously. And if you're out in the middle of a field or you're walking with your dog and your family, you don't necessarily need to wear one. I would have one on hand in case you run into that really friendly neighbor that has all the great intentions but doesn't know personal boundaries or the 6 feet rule. Because that mask is also a really good reminder to people to keep 6 feet. And so as soon as they come running up and then you put that mask on, then they kind of remember, oh yeah, and then they'll kind of keep their distance again, which is good. But definitely if you go to the grocery store or you go out in public at all, I would keep a mask on. There's a good analogy about the peeing in your pants one, which...
Oh, I've seen that. A lot of people have probably seen that on social media. Do you want to explain for anybody who hasn't seen it yet?
They can Google it, but I don't know if I can say it, but it is absolutely perfect. As far as, you know, it keeps, if you wear a mask, it keeps everything on you that is yours. And if they're wearing their mask, they have everything that's theirs on them. So it's better if 2 people are interacting to both have a mask. So I would hope that everyone has some kind of protection whenever they go out.
Great. And I do just want to mention that we've had some really gracious community volunteers donate some cloth masks that have been handmade. I know that's happening a lot in the community. So if anybody is viewing and is interested in getting a mask for a caregiver or someone who is leaving and coming back into the household, feel free to reach out to myself and we can help get you set with something up if we still have some available. So,
That's great.
So want to ask a question that's come up a few times, and I'd love to hear what your thoughts are. And it's in terms of just kind of managing symptoms and kind of knowing when is the right time to act on things. So this individual had said, I'm worried that because I can't be examined for breathing, swallowing, and mobility right now, some limitations around that. I'm worried that I might be missing the deadline for a feeding tube or for respiratory equipment. What would you suggest that person kind of do to stay as proactive as possible, but also stay safe during this pandemic?
Mm-hmm. So if they discuss those with just a virtual visit with their neurologist, I feel like all the clinics are doing virtual visits as far as neurology, at least. Mm-hmm. The insurances aren't requiring pulmonary function testing for respiratory equipment right now. So you don't have to come in for a respiratory test to get any of the respiratory equipment, which is absolutely wonderful. Mm-hmm. Because we're not, as far as Providence right now, we're not even allowed to do the respiratory testing due to the risk of having somebody blow out. So I would recommend discussing it. If you are feeling like you're short of breath, it's probably worthwhile to just go ahead and start getting that equipment, practice with it. Mm-hmm. And that's what we usually say is better. Might as well just get it early and start practicing with it before you really need it. There's no reason to wait as far as equipment goes. As far as a feeding tube, that's another similar thing. If you start to feel like you're having a steeper decline, I would discuss it with your neurologist. Obviously, I can't speak to that one as much because I don't know the individual. But if you're noticing a steeper decline and you're noticing your breathing going down and you feel comfortable with that and your neurologist feels comfortable with that, surgeries are starting to open up more. Mm-hmm. Once again, you don't have to have a respiratory test to get that surgery. So if the neurologist is recommending it, I would do it sooner rather than later, if that is something that you want. Obviously, that's a personal decision, but it's another thing, just like the equipment. If you wait till you can have all those numbers rather than just the qualitative data, then you're risking a little bit more there.
So a good kind of bottom line is if you're noticing changes in your care, it's always okay to come back to you and set up an appointment with the neurologist or just discuss this with the neurologist, because there's still a lot that's able to happen right now. And there's still a lot of support that's available for people, even if that doesn't mean coming into the office for a full-blown clinic.
Oh, exactly. We can totally get you set up with so much, even if we can't physically see you or get these tests that everybody's so used to done. We can still get a lot of that care done.
Great. So we had a question come in from Jerry Landreth, and he had a question for you, Lauren. When do you think might be a good time to resume Radicava infusions? Great question.
Yeah. So we've actually had that question quite a bit. We recommended most people take April off because that was the big COVID crisis. So now most people, if they are comfortable, we kind of are saying there's still a risk, but as far as the hospitals go, they are masking, they're taking temperatures at the door, and everybody's washing their hands. I'm pretty sure that my hands cannot be cleaner right now. So it's a risk, but it is a low risk, is how Dr. Goslin has said. So I would discuss that with your neurologist team. So Jerry, send me a message because I can't advise you over Zoom, but definitely we have been going back towards resuming some of those cares as far as infusions and some things. Obviously, there's still some people that are high risk that we're going to say maybe it's not quite ready not quite time for you. You know, if you have really bad, really severe respiratory weakness, it's probably better if you just take an extra month off. But if that's not the case for you, then it's probably okay to start resuming some of those medical care like infusions.
Okay, great. Thank you. I think it sounds like it's a, individual decision, but definitely something to talk about with the neurologist.
Yeah.
So we just had another question come in from Robin, and she asks, she says, it's harder to breathe with the mask. So I'm thinking about using my AVAPs if I was out. Is that overkill, or is the filter even good enough?
I actually haven't had that question. I definitely would not say that it is overkill, and I would have to look into that. I will send a message back and answer that question, but I don't think that it would be too much. And I think that it would still provide the purpose of covering your face because you have a mask on your face, where that's the big point of having a face covering, is that when somebody is talking to you, it's not going in your mouth, it's not going in your nose. So if you had that AVAPS mask on, it would cover all those areas. And if you're having difficulty breathing with a face covering, I think the AVAPS would be perfectly fine. And I think that that would be safer than going out without anything on your face.
Great, thank you. And if Lauren has anything to follow up with on that question, we'll be sure to type that in so everybody can kind of follow along with that. So believe it or not, we're actually coming up on our time. It's been really good to talk with you today, Lauren, and thank you for answering all of these questions. Before we close, is there anything else that you'd like to add or mention before we end?
I don't think so. Thank you so much for having me. Everybody, if you have any symptoms, talk to your nurse. Yes. We are here for you.
Sounds like a good bottom line. If you don't know the answer, go to the nurse.
Yes, like I said, I will look up the AVAPs and I will talk to Dr. Libby and figure it out, and I will get back to you. I know people.
Well, thank you again, Lauren. It's been really great to have you. And thank you for everybody who's been tuning in. We want to just let you know that we are going to be doing this again. So if you want to mark your calendars, May 28th at 3 p.m., we are going to actually have one of our care coordinators who works in the Willamette Valley region, Mary Rebar, on, and she is going to be joined by a family caregiver, Joyce Meyer, on, and the topic is going to be around building a care community. So we'll hope that you guys join and tune in to talk a little bit about that. And with that, we're going to go ahead and close, and want to just say thank you again, everyone, and we hope to see you all soon.